Okay, let's move from what's been happening along the LOC to what is now our top focus today. Because just when you thought that the COVID-19 pandemic was under control, there are now distinct fears that as winter sets in, as the festive season, and as we enter the festive season, the number of COVID cases are rising once again. The rise is particularly being seen in North India, where remember pollution levels have also risen. No other city is as affected as much as Delhi at the moment, registering more than 7,000 to 8,000 COVID cases per day, including 100 deaths on Thursday itself. All of which has now led the Delhi government to completely ban firecrackers, but also worry about what next to control the COVID spike, with hospital beds and the health infrastructure system once again under strain. Take a look.
Delhi is again in the grip of COVID. A day after recording the biggest single day spike of 8,593 cases, the national capital saw more than 100 COVID deaths on Thursday, the highest single day addition in 5 months. The state went to reassure citizens.
कोरोना बढ़ रहा है, इसको लेके मैं भी चिंतित हूँ। दिल्ली में पिछले कुछ दिनों से कोरोना बढ़ रहा है। जो भी उचित कदम उठाने की ज़रूरत है, हम वो सभी उचित कदम उठा रहे हैं। मैं उम्मीद करता हूं कि हफ्ते 10 दिन के अंदर फिर से कोरोना की स्थिति काबू में आ जानी चाहिए, कोरोना कम होना चालू हो जाना चाहिए।
Keeping in view the rising number of cases, the High Court has allowed the Delhi government to reserve 80% beds for COVID patients in 33 private hospitals. Fearing an increase in pollution during Diwali, the state government has banned firecrackers completely.
Data that we actually have for last 5 years, on the day of Diwali and the day after Diwali, PM 2.5 levels and overall AQI actually becomes worse by almost 23 times. When there's studies that actually says that if Delhi behaves itself, if Delhi really follows the ban that's been imposed by NGT, the previous Supreme Court ban, and also Delhi government's directive, I think we perhaps might have a better, cleaner Diwali.
Cracker sellers are fuming as they are staring at huge losses.
केजरीवाल साहब के निर्णय से, एनजीटी के निर्णय से, किसी निर्णय से मैं विरोध नहीं कर रहा हूं। एक सिटीजन ऑफ इंडिया होने के नाते बिल्कुल वो बात ठीक है, क्योंकि पॉल्यूशन खत्म होना चाहिए, कैपिटल है और पहले जिंदगी है, उसके बाद कमाई है। लेकिन डिसीजन टाइम से होने चाहिए। एक दिवाली ब्लैक होने की वजह से 4 दिवाली इनकी ब्लैक बनेंगी, क्योंकि ये ब्याज ही चुकाते रहेंगे, गोडाउन का किराया देते रहेंगे और वो गोडाउन भी इनके इलीगल काउंट होंगे।
गवर्नमेंट ने पटाखे बैन कर दिए थे, फिर सुप्रीम कोर्ट ने हमको ग्रीन पटाखे सेल करने का लाइसेंस दिया गया। हम लोगों ने पूरे साल फैक्ट्री लगाई और माल बनाया। पहले हमारे को लाखों करोड़ों का माल खरीदवा देते हैं, फैक्ट्री लगवा देते हैं, उसके बाद लास्ट मूवमेंट पे एकदम बंद कर देते हैं। ये तो सरकार की सरासर नाइंसाफी है और बेकारपंथी है।
Experts are of the opinion just after Diwali, people could see a spike in pollution levels. The farm fires which are taking place in adjoining states of Haryana, Western Uttar Pradesh and Punjab are also at an all-time high. Though after 6 consecutive days, Delhi's air quality has now dropped and it has come in the very poor category, but the air is still poisonous. Experts are asking the elderly and the young children not to step out, as the air in the entire Delhi NCR region has now turned poisonous.
To prevent crowding during Diwali, the Chief Minister and his cabinet members will be holding Lakshmi Puja at the Akshardham temple that will be telecast live.
कल दिवाली है, 7:39 से मैं और मेरे सभी मंत्रीगण अक्षरधाम मंदिर से लक्ष्मी पूजन करेंगे। मैं समझता हूं कि जब 2 करोड़ लोग मिलके एक साथ लक्ष्मी पूजन करेंगे तो दिल्ली के अंदर बहुत अच्छी तरंगे फैलेंगी।
Pollution and overcrowding in the festive season have led to jump in COVID cases in not just Delhi but across North India. The biggest worry for states ahead of Diwali is now fireworks. If the restrictions on crackers are ineffective, pollution is bound to spike, and so will COVID. Bureau Report, India Today.
And joining me now is the Health Minister of Delhi, Satyendra Jain. Appreciate your joining us, Satyendra Jain ji. The big question is, How prepared is the Delhi government for this sudden spike in cases? 100 COVID deaths yesterday, more than 7,000, 8,000 cases per day जैन जी हो रहे हैं और डर है कि ये और भी बढ़ सकता है दिवाली के बाद. Do you have the infrastructure, hospital beds, ventilators to keep up with the rising number of cases?
नमस्कार. सबसे पहले तो मैं आपको बता दूं कि देखिएगा दिल्ली के अंदर आज का जो स्टेटस है 8,600 के करीब बेड्स ऑक्यूपाइड हैं और 8,000 बेड्स अवेलेबल हैं. ऐसा नहीं है कि बेड अवेलेबल नहीं है. मुझे लगता है पूरे देश के अंदर दिल्ली ऐसा जगह है जहां पर इतनी बड़ी संख्या में 16,500 से भी ज़्यादा कोविड डेडिकेटेड बेड का इंतजाम किया गया है. और बहुत ही अच्छी बात है, कल हाई कोर्ट की डबल बेंच ने जो स्टे लगाया था पहले सिंगल बेंच ने कि भाई आपको आईसीयू बेड्स के ऊपर जो हमने प्राइवेट बेड में ऑर्डर दिया था 80% बेड्स आपको रिजर्व करने हैं कोविड के लिए, वो स्टे को हटा दिया है. तो आईसीयू बेड्स की थोड़ी दिक्कत आ रही थी और वो भी प्राइवेट हॉस्पिटल्स में. ये डेफिनेटली अगले 2-3 दिन में ये भी बहुत ही कंफर्टेबल हो जाना चाहिए. जहाँ तक हेल्थ इंफ्रास्ट्रक्चर की बात है, हॉस्पिटल्स की बात है, तो मुझे लगता है इस स्पाइक को हमारी तैयारी पहले से थी कि स्पाइक अगर आता है. और जैसा कि एक्सपर्ट बता रहे हैं कि ये जो कोविड का वायरस है कैसे बिहेव करेगा किसी को पता नहीं है. जून में जब आया था पूरा स्पाइक आया, फिर उसके बाद एकदम स्लो डाउन हो गया, फिर सितंबर में बहुत ज़बरदस्त स्पाइक आया, फिर स्लो डाउन हुआ, अब नवंबर में फिर से स्पाइक है. तो इसको थर्ड वेव भी कह सकते हैं. और इसका ना कम्बिनेशन जो थर्ड वेव है इसका थोड़ा सा कम्बिनेशन सर्दी भी है. पूरे नॉर्थ इंडिया के अंदर पॉल्यूशन बहुत ज़्यादा है, तो पॉल्यूशन की वजह से भी ये कोरोना ज़रूर फैल रहा है, बढ़ रहा है. और सर्दी का कम्बिनेशन होने की वजह से भी थोड़ी दिक्कत है. और वैसे भी देखिएगा हर साल जब सर्दियाँ स्टार्ट होती हैं तो काफ़ी जो एल्डरली लोग हैं उनके साथ दिक्कत रहती है बहुत ज़्यादा. और कोविड के साथ होने की वजह से जो कंबाइन होने की वजह से ये थोड़ा बढ़ जाती है. आप कुछ कह रहे थे?
नहीं, सवाल ये है सत्येंद्र जैन जी की सवाल ये है कि सोशल डिस्टेंसिंग की बात हो. आप देख रहे हैं दिल्ली मार्केट्स आर कंप्लीटली क्राउडेड, नॉट जस्ट दिल्ली बट अक्रॉस द कंट्री. जिस तरह से लोग अब बाहर जा रहे हैं, क्या कहीं ना कहीं ये जो आपने कोशिश की है कि कम्युनिकेशन कर दे लोगों को कि इस साल उस तरह की दिवाली नहीं हो सकती जो पहले सालों में हुई है, have people been convinced? क्या जनता जागरूक हुई है? केवल अक्षरधाम मंदिर में लक्ष्मी पूजा करने से जनता क्या है कि जनता जागरूक हो पाएगी?
नहीं, मुझे ऐसा लगता है कि फ़र्क तो ज़रूर पड़ता है. काफ़ी लोगों से जैसे बात हुई है तो वो कह रहे हैं कि हाँ इस बार हम पटाखे बिल्कुल नहीं जलाएंगे. और जैसे अभी आपके कोई बता रहे थे, मैं देख नहीं पा रहा हूँ कि भाई पॉल्यूशन जो दिवाली वाले दिन 3 या 4 घंटे पॉल्यूशन का लेवल इतना हाई होता है जिसके अंदर तो सर्वाइव करना ही बहुत मुश्किल हो जाता है. और जो कि पटाखे पूरी तरह बैन है, अभी ग्रीन और नॉन ग्रीन का कंसेप्ट हमने ख़त्म कर दिया, तो 100% बैन होने से बैन करना ज़्यादा आसान है. होता क्या है कि ग्रीन अगर अलाउड थे तो लोग दूसरे भी जला लेते हैं, उसको पकड़ना मुश्किल होता है. और ये कहना कि बैन इसका शायद बहुत अच्छी तरह इम्प्लीमेंट नहीं होगा, मुझे लगता है 100% इम्प्लीमेंट होगा. आज छोटी दिवाली है, मुझे एक भी पटाखा कहीं सुनाई नहीं दिया, आपको भी सुनाई नहीं दे रहा होगा दिल्ली के अंदर. और कल दिवाली होगी, ज़्यादातर लोग देखिएगा सब लोग कानून का पालन करना चाहते हैं. और इसमें तो बहुत क्लियर है, अगर जो पटाखे जलाएंगे उसके खिलाफ FIR दर्ज होगी, उसके खिलाफ केस चलेगा, बाद में बहुत लंबा भुगतना पड़ेगा. तो ऐसा कोई भी मुझे नहीं लगता है कि दिल्ली के निवासी ऐसा करेंगे कि पटाखे जलाएं और अपने ऊपर कहते हैं कि कानूनी कार्रवाई भी करवाएं. और दूसरी बात यह कि कानूनी कार्रवाई से बड़ी बात है कि अपनी हेल्थ को भी, अपने बच्चों की हेल्थ को, अपने पेरेंट्स की, समाज की हेल्थ को रिस्क में डालें. मुझे नहीं लगता है लोग ऐसा करेंगे. और इस बार इस जो पटाखों पे बैन लगाया है इसको जरूर मानेंगे. देखो जो ये सिचुएशंस है ना, पेंडेमिक है, हमारे जीवित जितने भी लोग हैं उन्होंने ज़िंदगी में ऐसा पेंडेमिक कभी देखा नहीं है. ये 1918 में आया था, उसके बाद 102 साल के बाद दोबारा से आया है. तो 102 साल के बाद जो पेंडेमिक आया है, इसका कैसे ये वायरस बिहेव कर रहा है, कोरोना वायरस कैसे बिहेव कर रहा है, कैसे एक्ट करेगा, कब खत्म होगा, इसके बारे में कयास ही लगाए जा रहे हैं कि भाई अब ऐसा हो जाएगा, अब ऐसा हो जाएगा. एक्सपर्ट्स पहले कहा करते थे कि भाई ये शायद गर्मी आएगी, 40 डिग्री टेम्परेचर होगा, खत्म हो जाएगा. तो वो सब चीज़ें पर कयास है. तो मुझे ऐसा लगता है कि लोगों को अब थोड़ा कोरोना से समझना पड़ेगा, संभलना पड़ेगा और अपनी जिम्मेदारी अपने ऊपर लेनी पड़ेगी. ये नहीं हो सकता कि मेरी कोई जिम्मेदारी नहीं है. कई सारे लोगों को मैंने सुना है, वो कहते हैं नहीं हमें तो कोई फर्क नहीं पड़ता, कोविड हो भी जाएगा तो मुझे क्या फर्क पड़ता है. हाँ बिल्कुल कोई फर्क नहीं पड़ता, आपकी इम्यूनिटी बड़ी अच्छी है, आप ठीक हो सकते हैं. नहीं, एक मिनट में सुन लीजिएगा, कई सारे लोगों को लगता है वो ठीक हो सकते हैं, उनको कोई दिक्कत नहीं है. बट अगर वो कैरियर बनते हैं, उनके बच्चों को हो सकता है, उनके माता पिता को हो सकता है, किसी और को हो सकता है, उसकी लाइफ को खतरा पैदा हो जाएगा। आपको समझने की जरूरत है कि जितनी भी डेथ हो रही हैं, मैक्सिमम डेथ एल्डरली पीपल की हो रही हैं, ओल्ड एज के लोगों की हो रही हैं। जबकि टोटल इन्फेक्शन, जैसे हम लोग पूरा डाटा रखते हैं, दिल्ली के अंदर 7 से 8 हज़ार केसेज आ रहे हैं, उसमें से 80% केसेज ऐसे हैं जो 20 साल से 50 साल के लोगों के बीच में हैं। जो एल्डरली 60 साल से ऊपर है वो बहुत कम नंबर है, परंतु डेथ सारी वहाँ पे ज़्यादा हो रही हैं। तो आप अननेसेसरी में, अगर किसी परिवार में यंग 20 साल का बच्चा है, 25 साल का है और उसको कोविड होता है, तो उसकी वजह से उसके माता पिता को हो सकता है। तो अपनी वजह से आप अपने माता पिता की जान को रिस्क में मत डालिएगा। सबसे सिंपल जो देखिए 8 महीने की कोविड के चलते चलते सबको समझ में आ गया है, सबसे इंपॉर्टेंट ये है कि जहाँ पर भी आप पब्लिक में जाएं, 1 से 2 आदमी भी हो जाते हैं तो मास्क जरूर लगाएं। अगर सब लोग मास्क लगाएंगे तो मुझे लगता है इसके स्प्रेड को बहुत अच्छी तरह से रोका जा सकता है, बट बहुत सारे लोग इस बात को नहीं मान रहे हैं। मास्क लगाते नहीं है, लगाते हैं तो गले में नीचे टांग लेते हैं और उनको ऐसा लगता है कोई पकड़ेगा तो उसका ऊपर चढ़ा के दिखा देंगे। तो जी
आपने एक तरह से जो दिक्कतें हैं उस पर फोकस किया है, द नीड टू बिल्ड अ सर्टेन कम्युनिटी सेंसिटिविटी अराउंड कोविड रूल्स और प्रोटोकॉल ड्यूरिंग द पेंडेमिक। मेरा आखिरी सवाल, और मैं संक्षिप्त में जवाब चाहता हूं, कि क्या कहीं सरकार ने सोचा है दैट मे बी यू नीड अनदर लॉकडाउन? देयर वाज सम टॉक कि मंडे से शायद इफ द केसेस कंटिन्यू टू राइज द नेशनल कैपिटल कुड हैव अ फ्रेश लॉकडाउन। क्या सरकार इसके बारे में सोच रही है या इसके ये सब अफवाहें हैं?
नहीं, लॉकडाउन के बारे में तो नहीं बिल्कुल भी विचार हो रहा है, परंतु जो भी रेस्ट्रिक्शंस हैं उनको थोड़ा सा सख्ती से लागू करने के बारे में जरूर किया जाएगा। कि कुछ लोग रेस्ट्रिक्शंस को फॉलो नहीं कर रहे हैं, उस पर सख्ती जरूर की जाएगी। होता क्या है कि आपकी एक आदमी की गलती की वजह से 100 लोगों को रिस्क में नहीं डाल सकते हैं, तो उसके ऊपर सख्ती बहुत जरूर की जाएगी।
So if someone doesn't wear a mask in public, Satyendra Jain ji, will you fine them? What are you going to do to them?
बिल्कुल उनके खिलाफ सख्त कानूनी कार्रवाई की जाएगी, उनको नहीं बख्शा जाएगा। क्योंकि देखिएगा, आपने खुद बताया कि मार्केट्स में बहुत भीड़ है। अगर 1000 लोगों में से 10 लोगों ने मास्क नहीं लगाया तो वो सबकी जान को रिस्क में डाल रहे हैं। तो जो मास्क नहीं लगाएंगे उनके खिलाफ जरूर कार्रवाई करेंगे।
Okay, that's good to hear, Satyendra Jain. There are tough times ahead of Delhi and indeed large parts of the country because of the COVID pandemic. Happy Deepavali to you, Satyendra Jain ji, and let's hope it's a peaceful and safe Diwali. Thank you very much
for joining me here at the top
of the news today.
Thank you, sir.
Thank you so much. Okay, let's move on to the big questions on my doctor's roundtable, because let's get in the experts. Will the second wave be deadlier? Is a question I want to ask. Why is the sudden surge in COVID cases? Will winter and the rising pollution levels only make the COVID situation worse across the country? How can the surge be controlled? What do you and I need to do in terms of protection? I'm joined by Dr. Hemant Thakkar, consultant physician at some of Mumbai's top hospitals, one of Mumbai's top doctors, joined by Dr. Harsh Mahajan, founder Mahajan Imaging and one of the country's top radiologists, and Dr. Arvind Kumar, Sir Gangaram Hospital, one of the country's top lung surgeons. Appreciate all three of you joining me here on this Doctors Roundtable. Dr. Thakkar, to you first. Are you surprised when you've heard about the sudden spurt in cases that have taken place in large parts of the country, but particularly in the most polluted parts, including the national capital?
At the outset, today is Dhanteras, and I want to remind all your viewers, Rajdeep, that in 2020 especially, not that before that it wasn't there, your real dhan is your health. And in 2020, if you do not earn and protect your health, you're going to be in deep trouble. Coming to your question of surprise, I'm not surprised, because I've seen on your channels and a few other channels that I do watch that there is a surge in the markets. People are walking with gay abandon. They are not worried about the promiscuity and the proximity of people. Now, the cold and the pollution was expected. We also know that the heavy particles which contribute to pollution, on that the virus will piggyback. And when it rides piggyback on the pollutant particles, inhalation of these particles, because the virus will last longer, is going to cause a dual problem in the respiratory tract. You're going to have pollution-induced problems and viral-induced problems. So you have to, like there is your first media news item was line of control and breach. The same line of control has been breached.
Yes.
People have forgotten and they thought Diwali is the festival of lights and abandon, and they've gone about it. And especially in the north, when there is the cold air,
it's COVID
and the
fatigue.
cold air breeds pollution, and
Dr.
pollution.
Thakkar, it's COVID fatigue.
Yes, I don't deny.
I wonder,
there is
Dr.
COVID
Thakkar, whether
fatigue.
there's an element of COVID fatigue.
I agree with you. There is a very significant element of COVID fatigue. Yes. But this is where the media and the health authorities have to be absolutely persistent. We are 3/4 of the journey done. We have another 3 months to go. There is light already showing at the end of the tunnel, whether Pfizer shows it, the Russians show it, or Astra shows it. We cannot afford COVID inappropriate behavior, because these last 3 months can produce a wave which can be deadly. And you have seen it in America and in Europe. They went out for their summer vacation. You see, in New York, there is an advisory. We have Diwali, they have Thanksgiving. And the New York governor has said not more than 10 people in a house to celebrate anything. We have to be cautious. Your mask, right. The fine for not wearing a mask should be exorbitant. And the police have to police it more than the cracker ban. You have to see that people protect themselves. Otherwise, we're going to go back to square one. The second wave can be worse than the first.
I think those are very cautionary words there from you, Doctor. Let me take it to Dr. Arvind Kumar, because as a lung specialist, Dr. Kumar, are you seeing a direct connection now between rising pollution levels and the number of COVID cases? And what does that then mean, particularly for those who may have comorbidities?
Thank you for having me on this show, Rajdeep. I 100% echo what Dr. Thakkar has said. Very appropriate and very well chosen words from him. There is a direct correlation between lung involvement and COVID levels. What we are seeing in Delhi and rest of North India is no surprise. There was enough data available from China, from Italy, from rest of Europe, from USA, which had clearly and categorically stated that rise in pollution levels will lead to rise in COVID, number one. And number two, if you say go by to the 3 cardinal principles of prevention of corona, which is wearing mask, social distancing, and hand hygiene, you will have a surge in COVID cases. What we are witnessing in New Delhi and will witness very soon in rest of North India is result of 2 factors. One, because of whatever it may be COVID fatigue, it may be the festivals, whatever reason, people in the last few weeks have given a go-by to the 3 cardinal principles. But more importantly, coupled with that has been a serious rise in pollution levels. And these 2 together are responsible for the current steep hike. And there lies the cautionary note for the coming few weeks that again in the next few days, there are series of festivals where eating, meeting, greeting people is the norm. And people are now preferring to celebrate festivals rather than prevent corona. And along with that, ban or no ban, I suspect that there will be crackers tomorrow, leading to further rise in pollution. And this will lead to deadly effects as far as a serious rise in COVID cases in Delhi and nearby areas in the next few weeks, with increasing number of deaths. COVID not only increases in incidence in pollution affected areas, the mortality is also higher in pollution affected people. So you have more cases and you have more higher percentage of mortality. Both these we are seeing in Delhi and we will continue to see in the coming few weeks in Delhi and rest of North India if we don't take preventive measures. Rajdeep.
You know, again, a cautionary note being sounded by one of the country's top surgeons. I want to come to you, Dr. Mahajan, because as a radiologist, I know that you and your organization are doing a lot of rapid antibody tests. There are antigen tests also happening in Delhi, and I want to get a sense about testing, because I got myself tested today. Someone had come to see me a few days ago and tested positive for corona, so I got myself tested. And when I asked the person who tested me, he said, I have just finished 60 tests already, and it was only 4 o'clock in the evening. So I want to get a sense from you. Do you believe that the testing protocols are in place? Do you believe that there are cases where a person is testing negative in the morning, does another test the next day, and it tests positive? Are testing protocols in place to handle this spike in corona cases?
Thank you very much, Rajdeep. And to answer your question, we do not do rapid antigen tests. We do the gold standard RT-PCR test. And you're right. Yeah, you're right. Yes. A lot of the tests being done in Delhi and in other parts of the country are actually rapid antigen tests. In Delhi, about 60 to 70%, or maybe at times even 80% of all tests done on a daily basis are the rapid antigen tests, and about 20 to 30% are the gold standard RT-PCR tests. So we need to be clear about one fact, that the rapid antigen test is a good test when it tests positive. At least that's what we see in, and it can actually miss a lot of the positives. So it has a lot of false negatives. In fact, the ICMR itself said that its sensitivity is about 50%, which means that for every 2 infected patients, it'll pick up 1, and it'll PCR test is the gold standard, but this also is not 100%, as you would expect a gold standard test to be. Today, I would say it's more around 80%, 85% sensitivity. So when someone does one test and tests negative on one day and tests positive on the other, it's not surprising. It's not that the lab didn't do its work well. The manner in which the sample is collected can also make the difference between a positive test and a negative test. And the coronavirus also is known to shed very differently throughout the day, day to day, between days. And you may have a low viral load on one day and a high viral load on the other, and you're able to, have this discrepancy. But in Delhi, we are. But
are you seeing more and more patients who are asymptomatic?
Yes, yes.
Are you seeing more and more patients who are asymptomatic, and is that what you're seeing in the tests?
Yes, we are seeing a lot of asymptomatic patients, and also the antibody testing that has been done as a sero survey in Delhi shows that maybe for every symptomatic patient, there may be 25 to 30 persons who are asymptomatic. These are people who just don't know that they have the disease. And that's the problem. With letting down of the guard, as the previous speakers have said, with the festival season, the cold weather creeping in, people are letting their guard down, the masks are around the neck, as Dr. Thakkar said, and with this, you eat together, you drink together, you talk in groups, and that is what is leading to this surge, apart from the fact that with pollution, the numbers are going to increase because, as has been said, the virus piggybacks on the dust particles, and also the fact that you have more of serious disease because the pollution itself causes inflammation within the lungs. Super added on that, the infection, and you have someone who's mild going into moderate, and someone who has moderate disease, severe disease. So it's a combination of factors which have come together. But
I think all three
is important. Yes, please.
I think all three of you have put cautionary tales. I want to come to you, Dr. Dr. Thakkar, because in the next few days, there's Diwali on the weekend, then there's Chhath Puja, whereas we've seen people gather again in large numbers, and there will be a series of festivals leading into the new year. There are also people who still want to organize their card parties, hold tash parties, whether in any part of the country, to celebrate Diwali. What is your advice as a physician? What would you advise people who still want to go out and celebrate, if necessary, even in small groups? Would you advise it, or would you say, please stay at home this year?
As far as celebration is concerned, you have to restrict it to your bubble group if you have to celebrate. Now, I cannot be more Catholic than the Pope and say don't celebrate, because the human nature, which is already COVID fatigued, will not accept it. So I will say what we have allowed is your COVID bubble. You have a maximum of 3 couples, and these couples, you know their whereabouts, you know their antecedents. You also see to it that when you meet, you are socially distanced. The kissing, the hugging, the proximity has to go. You have to wear your masks, and you have to see that when you go out, you have a mask all the time. And if you're with a stranger, have the mask. Avoid shopping. Do not go to public places. Do not go to public gatherings. And the large Diwali parties, which some of the newspapers and channels are portraying, have to be shunned. This is 2020, a year with a difference. If you look after that, you'll make it. Ask the widow who's lost the breadwinner of the family, or the grandchild who's lost one grandparent. We've fought in ICU for 15, 20 days, every day, to come out crestfallen and tell relatives on the phone that you'll never see your loved one again. Don't let pollution, the cold, the crackers, COVID fatigue, and the virus hit you.
Are you saying no, even when you celebrate, no amount of any physical intimacy, no hugging, no sort of nothing that you believe you should maintain a social distance even within the bio bubble, is it? Or even within your small group bubble is what you're saying?
If you did not hug for a year, you did not lose anything. You can't be like Munna Bhai MBBS and think about the hug. Your hugs will come next year, but you cannot afford to, because you don't know the antecedents. Somebody whom you met yesterday tested positive today, and then you spend the whole night worrying when you touched him, when you hugged him. What's the need? You have met him, that's enough. You haven't met him for 6 months, now you're meeting him after 6 months. Which Diwali says you must hug and greet and physically have proximity? I think caution is the way forward. The namaste is the best. Today is Dhanteras. Health is wealth. I keep repeating this because I'm scared. We did see a flutter in Mumbai after Ganpati. As of now, Mumbai is good. I want to, every morning, but I get up, I see the number of missed calls that I have missed at night. And I realize that still we are okay. Let's keep it that way. This is my prayer.
You know, that you're putting it very well, Doctor, as always. Health is wealth. But Dr. Arvind Kumar, asthmatics in particular, should they be even extra careful? If I'm an asthmatic, avoid any kind of gathering this year?
Rajdeep, I would echo what Dr. Thakkar said. It's not, let's not give a false sense of security who are not asthmatics by focusing on asthmatics. Everybody must practice caution. I would like to say one thing. Diwali will come every year. It will come in 2021, 22, 23. If I lose my life this year due to my festive activities, my family will have next Diwali but will not have me. Why don't we understand this simple fact that this corona is not here forever? In a few months' time, vaccines will be available, and God willing, 2021 Diwali will not have the corona impact as 2020 Diwali has. So it's a one-time sacrifice. Why can't we have digital? After all, earlier, all of us used to come to the studios for these meetings, but today all TV channels have more number of people participating without anyone coming to the channels. We have moved to digital methods. We can, at least for this year, have our festivities through digital methods. And as Dr. Thakkar very elegantly said, avoid physical meetings, definitely avoid hugs and kisses. Please, I would give a very good formula. Presume every other person to be positive and presume every surface to be positive for corona. Anything you touch, you must wash your hands, and everybody stranger other than your immediate family members, if you see, presume them to be positive. Insist on their wearing a mask. You also wear a mask and maintain 1.5 to 2 meters distance. Definitely no hug, no kisses. Use digital means. It's just one-time phenomenon. If we can avoid a steep spike in COVID cases in the next few weeks, Rajdeep, we would have definitely saved a few thousand lives across the country, which is what, as a doctor, I would like to see. Rajdeep.
So basically what you're suggesting is let's celebrate, but celebrate digitally. Change the way we are celebrating Diwali. Yes. But Dr. Mahajan, a final word from you, because would you advise people who fear, who may be getting symptoms or may have met someone who's got COVID symptoms to go through the RT-PCR test, avoid the rapid antigen? A quick final word on that?
Yes, there's no doubt in that. If you suspect that you may be having COVID, or if you've come in contact with someone who is known COVID, and normally it happens, you meet someone and a day or two later, that person will ring you up and say, hey, I got it. And you've been with him. You have to remember that from the day of the first symptoms, 48 hours prior at least, that person is very, very infective. And so if you met him when he was absolutely fine and got it a day or two later, you have been in contact. The ideal thing would be, as has been said earlier, always wear a mask and consider the person sitting across you to be positive and take all precautions. But if you've not done that, and even if you've done that, it is better to test, because if we test, then we know for sure, because it's not only about ourselves, and that's something one has to realize. It is about all people around us, our family, our friends, people in our office. And so it is important to test. And once you've decided, it should be RT-PCR.
Okay. Final word from you, Dr. Thakkar, as we wind down. Just a quick comment on this. Is it safer to be at times outdoors than cooped up in your house? Because I have conflicting views that come in on this. Are you better off, even if you were to, let's say, celebrate during the Diwali weekend, should you celebrate outdoors or indoors?
So if you have to meet 3 or 4 couples, if you're in a garden or in a terrace, you're better off because the circulation of air is better and you are not in an air-conditioned room where there is recirculation. So that way you are better. My message for Diwali would be, Diwali is a festival of lights. Let the light be the enlightenment in your mind to be dutiful. Diwali is a festival of sound. Let the sound be the thumping in your heart of guilt and again duty. And the sweetness of Diwali will flow if we pass this litmus test till the 1st of December and we don't see a second wave. We've made it, folks. Let's hold hands. Let's wear masks. Let's keep distances and let's think of everybody besides yourself. Happy Diwali.
Happy Diwali to all my doctor friends who've joined me on this roundtable, Dr. Thakkar, Dr. Mahajan, Dr. Arvind Kumar, and thank you for sharing your wisdom with all our viewers. I hope that the message is loud and clear. This is a Diwali with a difference, a Diwali where health is truly a sign of our wealth. Thank you all very much for joining me here on The Doctors. Take a break at this point.